Hi, I'm Dr Neil Israelsohn, obstetrician gynaecologist at Epworth Freemasons Hospital. When deciding between delivering either vaginally or by caesarean section, there really are a lot of decisions and a lot of factors that need to be taken into account. But what is absolutely critical is that each patient has the opportunity to have this discussion with their obstetrician to go through the issues and work out what is best for them. Family size is important because when you're considering vaginal birth, the first one is by far and away the hardest. It's more likely to be associated with the need for help with vacuum cup delivery or forceps delivery, but not always. Once you've had that first vaginal birth, the subsequent vaginal births, whether it's second or third or fourth, are usually much easier. Caesarean section, on the other hand, for someone who may not have had any abdominal surgery before, the first caesarean section is usually pretty straightforward. But with each subsequent caesarean section, the risks begin to increase, especially with regard to the risk of the placenta attaching to the scar from the previous caesarean section. That does go up with the more caesarean sections you have. It's mostly an issue for women who are planning on having larger families, 3 or 4 or more babies, etc. But it certainly can happen if you're unlucky after 1 or 2. And so trying to get an idea about what planned family size is certainly an important part of the discussion. A lot of patients focus on the short-term recovery and the difference between vaginal birth and caesarean section. I think with vaginal birth, there's more unpredictability with regard to what the long-term recovery will be. And especially with regard to the pelvic floor muscles, the muscles that hold the pelvic organs in position, and also the muscles that are important to prevent you leaking urine when you cough, sneeze, jump, laugh, etc. Caesarean section has the least ongoing effect on those pelvic floor muscles and how they might perform over the subsequent years. Those women who have a vaginal birth, whether it's with or without the assistance of vacuum cup or forceps, there is a greater effect on the pelvic floor, and for the majority of those women, their pelvic floor will heal and recover, and they will not have long-term problems with their pelvic floor with regards to prolapse or with regards to bladder incontinence. But there are some women who, despite time and despite good physiotherapy, still have ongoing problems with the pelvic floor months or years down the track, and the chance of that happening is just that little bit higher with vaginal birth than what it might be with caesarean section. There are some patients who feel very, very strongly that they desperately want to try and have a vaginal birth, and there are some patients that don't really place a lot of importance on that at all. And so again, it's really important to speak to each and every individual patient to assess exactly how they feel about vaginal birth, how important it is to them, and how much they want to go down that path. There are a few reasons why a caesarean section would be recommended over a vaginal birth. The least controversial is placenta previa, where the placenta is implanted low down in the uterus, very close to the cervix, where the risk of bleeding associated with vaginal birth is really high, and as such we strongly recommend that those patients have a caesarean section. The second most common reason would be breech presentation, so a baby that is sitting in the uterus in a bum down or feet down position. And then the third reason is based on size. For those babies that are thought to be extremely large, we would often recommend a caesarean section due to the risk and potential complications associated with the shoulders getting stuck during delivery. For those babies that are really small and who may not tolerate labour, for whom there's a risk of fetal distress and emergency caesarean section, sometimes the caesarean section is recommended under those circumstances as well. And the last reason is for those women with very specific maternal medical conditions where it's thought that it's not safe for them to push. For the majority of women, the short-term recovery from vaginal birth is usually better than what it would be for caesarean section. But it's a matter of days and a couple of weeks rather than several weeks like most women. So with vaginal birth, even if it's associated with often swelling or stitches, most women after a vaginal birth would recover within a few days and are feeling pretty comfortable by a week or 2 weeks. With caesarean section, it takes a full 6 weeks for the internal stitches to heal fully before women are able to do strenuous exercise or strenuous activities. They're often up and walking within a day or 2. They're feeling pretty comfortable within a few days, albeit with the use of medication to help with the discomfort. They're by no means restricted to bed or restricted to the home. With regards to longer term recovery, vaginal birth will have a bigger impact on the pelvic floor and the pelvic floor muscles that support the pelvic organs like the bladder and the bowel and the uterus, and also how the bladder functions and stopping the bladder from leaking urine occasionally under stress. So when women cough or sneeze or run or jump or exercise, those pelvic floor muscles need time to heal. Often a physiotherapist will help women with certain exercises that they can do to help that recovery. And for the huge majority of women who have had a vaginal birth, those muscles will heal and recover well so that they don't have long-term problems with regards to prolapse or bladder incontinence. There are some women after vaginal birth who do have more ongoing problems. They need further help with the aid of physiotherapists. And this is an issue which is more specific to vaginal birth than what it might be with caesarean section. It's important for women to understand, however, that while vaginal birth may have a longer term impact on the pelvic floor muscles and how they function, that the majority of women will not have long-term problems and the majority of women will heal and recover well, and they can be reassured by that. So with regard to the decision about whether it's safe to have a vaginal birth after a caesarean section or not, under almost all circumstances it would be a safe option, but something that's worthwhile discussing with your obstetrician. There are a couple of situations for which we would strongly recommend a repeat caesarean section as opposed to a vaginal birth, and those are mainly if the incision on the uterus happens to be vertical. Most caesarean sections are done with a horizontal incision, but occasionally there's the need to do a vertical incision on the uterus, or sometimes there are extra tears when you've done a horizontal incision, and under those circumstances it is deemed not to be safe to have a vaginal birth in a subsequent pregnancy, and we'd strongly recommend a caesarean section.